Welcome to Uganda, where a coalition of organizations has been working tirelessly to advocate for sexual and reproductive health rights for all young people and right here, right now.
Well, the program is funded by the Ministry of Foreign Affairs of the Netherlands. So Rutgers, as part of a consortium of 6, also recognizes the value of partnership and some of the expectations from this to work together in the different countries where the program is being implemented to realize sexual reproductive health and rights for all young people.
Different program implementers came together to draft a new program that was more inclusive, that was bottom up, where different stakeholders, including young people themselves and local partners, came together to draft a new program which is running for 5 years and now it's coming to an end. So the background to this is that even then we're reflecting on the SRHR indicators. If you look at the 1994 ICPD program, the report itself indicated that there was progress, yes, in addressing SRHR indicators, looking at the geographics, the health and the social changes that were then, but then still we observed some inequality in terms of progress as a result of the different structural barriers.
The Right Here, Right Now project, implemented by CEHURD, RHU, RAHU, SRHR, Alliance Uganda, UNYPA, REACT, and Hope Mbale, aims to empower young people, reinforce positive norms, and advocate for gender justice.
RAHU brings on board its expertise of bringing together young people, while RHU is into service provision for young people, but also advocacy. CEHURD has the legal expertise and ensuring that the environment is okay. REACT brings in the diversity of the young people. UNYPA focuses on young people living with HIV. Hope Mbale, again, young people of diversity, but based in Mbale. So you'll notice, for example, that each of these has been working on various interventions, but within the Right Here, Right Now program, it is really to come up with a space where young people are able to openly speak and debate and have their decisions heard when it comes to sexual reproductive health and rights. I think it's an intervention that we have overly not given them that space. Of late, after the program, you realize that they have the space. They know what to do, who to go to, how to advance their rights, which is coming through a structure of the Youth Advisory Committee that was formed as part of the Right Here, Right Now program.
Meet some of the young people who have benefited from the project.
Joining the Youth Advisory Committee under Right Here, Right Now was an opportunity for me to also discover myself as a person, but to also learn about sexual reproductive health and rights in the scope of policy. Learning how to advocate for a policy, how to push for those policies that are inclusive for everyone, and also, as I said earlier, holding our leaders accountable. The Right Here, Right Now has really been an opportunity for me to learn, but not only to learn, but to also influence other persons with disability.
Personally, I also gained confidence. I've also gained different skills that have helped me to reach out to different communities where I find adolescent girls and young women mainly living with HIV, that have been able to support them with the rightful information and knowledge that they need to protect themselves with.
It was very insightful to me. I got to learn a lot of new things. Of course, I did know some knowledge about this reproductive health rights, but with the trainings, my knowledge was further enhanced, and I can say that the trainings were very informative for me. My self-esteem has skyrocketed. I'm more confident, I'm more eloquent in communication. It has also increased my social capital, interacting with the young people and the fellow young persons and the peers that we were educating.
I've really benefited from CEHURD in a lot of aspects in life, that is generally in SRH. And when it comes to policy, CEHURD has really taught us that as young people, we should really know what could be our rights and where do we need, in case someone needs to be directed, where do you run to as young people? And right now, through the information I got from school, at least I can support my young people with the right information, very well informed. And when it comes to SRH and GBV, at least I can give them the right way and the right information where to run to. And in case of anything, at least they can also be engaged somewhere through that.
I identify as gay man. Now I work with Hope Mbale as a peer educator. They have taught many things. Now I can advocate for my rights. I can express myself freely. I can access services anywhere I want because I know my rights, where I can access, and there are many places where I can access services in countrywide. They have empowered me with all that knowledge. It has impacted my life, so I can bring out my fellow peers. I educate them. I can gather a gathering of my fellow peers and community members. Also, I teach them about our sexual orientation, so they cannot discriminate us in case we are accessing services.
As a non-conforming person living in Uganda, first of all, the project has helped me with skills and information when it comes to sexual reproductive health and rights, first of all, and justice, that I've been able to use in my day-to-day life as a student leader at Uganda Christian University. I get to meet a lot of students that have issues when it comes to their reproductive health and also sexuality. So the project has given me a platform, first of all, to meet their needs, to actually talk to them and inform them about different perspectives when it comes to the certain topic. And also through the platforms that they've created using social media platforms and also subspaces, we've been able to interact with a lot of people that have empowered the young lives in Uganda and also the minorities living in Uganda at large.
The project has helped me to make sure that all the time when we are looking at, when it comes to SRHR services for all young person, we should be inclusive in all ways. Like we should include all people, regardless of their gender, their identity, their sexual orientation, their disabilities. So as it's the fact that everyone has a right to have or to receive health services, specifically sexual reproductive health services, the project helped me to always come out and challenge different stereotypes. Now, for example, when it comes to queer women, lesbian women, young persons, or girls and young women with disability when they're accessing SRHR services.
Representing my fellow queer young people has been a satisfying experience as well as a bittersweet experience at some point. It means to me that at least they always have a voice in the project, right from root level up to where the decisions are made. If at all we did not have a representative on that committee, it would mean that we would be left out and we would not know that we also have the right to SRH services and information.
Through education, skills building, and support, these young people are now making informed decisions about their sexuality and health.
Through the trainings that I have gone through, I have managed to get information on my sexual and reproductive health and rights, which has impacted me in my decision making, in my friendships, and in my day-to-day life. It has also given me a platform to voice out issues that are affecting young people in different platforms.
Health-wise, I've got some basic measures to take in case I have a problem. I've learned how to make sanitary towels out of local materials, and I've got ideas that I can use to apply in my life in the outside world. I've learned many ways of overcoming sexual harassment. The people I can report to in case I have any problem. Other ways of interacting with an opposite gender, and safety ways to take to fight against sexual harassment.
Yeah, the life changed because we learned more skills. We as boys, how we can past adolescence stage. You know, adolescence stage, it is a stage where everyone is very active. Even it cannot be controlled by someone. Yeah, we learn how to control ourselves and control other people. Because if this time I find that is there any girl in menstruation period, they know how to handle that girl. Because we as boys, you could find a girl in menstruation and you laugh, but we are fighting against that. When you find a girl who is in menstruation, handle but don't laugh.
It has helped me make informed decisions. For example, I know that as a young person, I have my rights. When I go to the health facility, I have a right to get the services that I need. It has really invited the spirit of confidence in me through Right Here, Right Now, where when we were introduced to the project, we were told that issues concerning the youth should be handled there and now. So I learned that I have to open up to a health worker and get my services there and then.
Right Here, Right Now has been able to help civil society organizations set up programs that bring young people together to discuss issues affecting their lives. These programs are positing norms, value, and perceptions about access to SRHR-related services for young people.
Part of what we are looking at with Alliance Week is showcasing the power of young people. And if you see the activities that we've been having, from the grand entry event, we had young people leading the dialogue and making sure that the leaders are, having a call to action and ensuring that they're listening to us. From the in-school sessions, they're being conducted by young people, for young people. The health camps are also being conducted for young people and by young people. So I would say, yes, we are meeting our objective, but we are also going above, because what we are also realizing in this Alliance Week is the power of youth-adult partnership. We have seen young people working with the adults, and it is working magic, and it is something that is really beautiful.
So the intergenerational dialogue is mainly looking at addressing the inequality and sexual reproductive health issues that are affecting the young people in Uganda. We are in Kasese district, one of the districts with the highest rates of teenage pregnancies, and one of the key implementing districts under the Right Here, Right Now 2 program. It has been graced by the Queen Mother of Darwin's Rural Kingdom, and we have listened to the leaders, to the religious leaders, to the cultural leaders, to the district officials, to duty bearers from Ministry of Health that have come on board and told us what they are trying to do to address some of these key SRHR challenges. RHRN Uganda, we have gone ahead to disseminate the re-entry guidelines on teenage mothers into schools, and because we noticed the gap and worked with the Ministry of Education to ensure that schools in both Poto and Kasese district are adequately addressed in that area, and we are seeing improvements.
As Minister of Education, what are we doing on young people health, on their sexual reproductive health? To begin with, I'll say that there's a lot of political willingness to solve the issues of our young people. And so the Honorable Minister, who is also the First Lady, is very keen on young people issues. She even has programs deliberately put by herself to engage young people across the regions of Uganda. But I should also inform you that as a ministry, we are known for what we call integration of health matters into all other school programs. For example, we have encouraged our schools not only to concentrate on academics, but to also remember to handle the other challenges of our young people, the teenage pregnancies I'm mentioning, and the drug abuse in an integrated manner. What do I mean? That even when I go teaching chemistry in class, I should mention all the formulas, but not forget to remind the children about the dangers of early engagement in sex, the dangers of STIs, and so on.
So I was not all that exposed before joining this RHRN, but when I joined it, I had more of the skills added to me, because I was able to interact with many of the youth in schools and in communities as well, and it had added value to me, sure, and I'm so grateful about that.
Conducted what we call the CEHURD Law Moot, where we have young people in law school coming up and getting to understand, to learn more on how to advocate and how to manage cases around health and the law.
The moot court helps you to have a hands-on experience when it comes to drafting. This a student first packages that. Then 2, oratory skills. Okay? Many students are shy. Most of them lack confidence. Most of them don't know how to address justices. Once we come to moot, we meet these judges. They guide us personally on an individual basis. I would really want to thank CEHURD for all these opportunities that are available to students.
The inter-university dialogue has improved my mental health. It has also helped me with my thinking concerning sexual health.
I've learned how to manage sexual conversations better because before I joined Reproductive Health Uganda, I used not to be so fluent and confident to talk about sexuality, and it has opened my mind into understanding that it's okay to speak about these things and understand how to handle them.
The project has also engaged cultural and religious leaders, members of parliament, and community members to promote positive norms and values regarding SRHR and gender justice.
So through the Right Here, Right Now project, we have been able to mobilize the communities, to demystify some of the myths and misconceptions, because we have been able to go to the communities and mobilizing people to realize that, well, issues of menstrual health management, these are our issues at the community. Issues of child pregnancies, teenage pregnancies, child marriage, these are our issues. Then issues of service delivery. We have seen a drastic but also spontaneous change in the attitudes of people, especially the social norms. Some of these have changed. Many young girls can now speak. Many young girls, the picture has changed from seeing women as merely sex objects to being people of value and honor. Then attitudes towards family planning, some of these have changed because of the Right Here, Right Now. But these have changed through community mobilization and continued engagement and dialoguing with the communities. So Right Here, Right Now as a community-based project, personally, I have seen some social norms changing, especially with people that were so tight and could not respond to any of such issues.
Don't walk alone. Whenever we move, we'll go back to church. Whenever we go, we'll come back to government. Wherever we go, we'll come back to civil society. Therefore, we are ready to win this battle. Let us kill the monster. Commit myself. Before Mulerembera, the cabinet you, if not a that took in the Bayaka Mama School Banaban. Because we need you. We can organize as parents and we talk about the life of our families and the future that we desire our children to have.
So as far as I'm concerned and as a cultural member of the Sebei region, we see right now, right here, as a project which has done something great. We have sensitized our children and they now know that the other circumcision or girl mutilation is not of good luck. And where we are going, the direction we are heading to is towards having alternative rite of passage, not as it used to be, but in this direction. But it should be gradual. And you know, it doesn't just come like that and you find something changing all of a sudden. But this should be going slowly. But there is a good step which has been taken, good impact.
Amgacha Igalia la Majibrasha Jangalon Amgacha Tinel Munda Uwaja Kama Atanya Ugalia illa Majibralevo Amgacha Legibralevo le Zerit Gacha we never Manduba Latet the Megonda Galefa Waga Ogalia Mbale Yes,
Slowly but surely, attitudes are changing and communities are becoming more supportive of young people's SRHR. The project has advocated for policies and laws that enable young people's SRHR and gender justice.
We want to commit ourselves that we will interest government to make sure that we appropriate funds for child protection issues, and particularly seeing how government can ensure the implementation of the strategic plan on ending child marriage in Uganda. But we also want this discussion not to end here in Kasese. We think this discussion can be taken at a higher level, and we have invited the organizers that we need to come up with a petition which can therefore be discussed at higher levels. And of course, as legislators, we are committed to ensuring that we come up with appropriate laws. And if there are any laws that no longer suit the current situation, we are ready to see that some of the laws are amended, and we are ready to push them on floor of Parliament. I personally belong to the Committee of Gender, Labour and Social Development, and the issues that have been discussed here are not only issues for Kasese, but I can see they are issues generally for the whole country in Uganda.
As policymakers and specifically from the Ministry of Health, we will commit to implement the interventions that we have put in place. There are many interventions to provide adolescent responsive health services and quality health services to our adolescents, and we shall continue to train our health workers to make sure if any adolescent comes to the facility or as they go out for outreach posts, our adolescents are taken care of, they are listened to, they are communicated to in a very nice way, and also the services that they need are actually delivered.
Government officials are now more aware of the responsibilities to uphold young people's rights.
And it has also brought many people on board to know what they're supposed to do, especially the political side, the youth leaders. They were not aware of some policies and some services which are provided at particular health services. So this alliance week has brought us together, the community and the health team and other implementing partners, to understand the instance of sexual reproductive health among the youth. At least most of us, those who are trained, we can do on-site mentorship and coaching on youth-friendly services. We can formulate those youth-friendly corners and give information.
When the project started, we never had a ramp. But if you go to Kapchorwa General Hospital now, there's a ramp for access, and is going to support, which has supported all the young population in the district. So we're happy with the project as a district, and they has also supported us in training health unit management committees and the hospital boards for Kapchorwa General Hospital and then Health Center 4. In terms of governance and leadership, we realized that these committees didn't have the youth representation in these committees. But when the project came, we identified as a gap, and nobody was addressing the youth issues, the young population issues in health facility. We already now have youth representation in our health facilities.
We used to have school dropouts. It was on a high rampart in the whole district. We would rank #1 Kasenda. We also used to have premarital marriage of sex, children that emanating from dropping out of school. So since right here, right now, project came, a lot of things have been realized. As we talk now, some children even who had dropped out of school are back in schools, in some schools, some money and be well off. So because of right here, right now, the knowledge they gave them and the sensitization, so in conjunction with us, the leadership of the sub-county, we have realized that change.
That we are empowering the HIV positive living youth. Then basically, we as well do counseling on sexual health. We give them family planning. We do STI screening. and treatment. Then as well, we do pregnancy testing and counseling.
The project has strengthened civil society organizations, enabling them to better serve young people's SRHR need.
Since 2021, we've formed many youth groups in the 6 sub-counties in Kapchorwa district and the 6 sub-counties in Kwen district. And these youth groups have been trained. We've had several engagements with them. This include trainings, these include activities, debates, dramas, which are aimed at giving information to young people and at the same time empowering them to advocate for their rights in our sub-region.
Together, we can achieve a gender-just society where all young people can thrive. Join us in calling upon the government to fulfill and protect the sexual and reproductive health and rights of all young people in Uganda.